Hello, my name is Mark DeWald. I'm here tonight to talk to you a little bit about CPR. I have been in the EMS field for over 16 plus years. I am an instructor of CPR, and I have been involved in many trauma situations that involve life-saving techniques. Real quick, I can recall 6 very clearly that I gave CPR to. I want to ask you if any of you believed I saved all 6 patients. Just raise your hand. Okay, there's 1, 2. Okay, you 2 are wrong. Unfortunately, I did not save all 6 patients. I saved 1. That would be a 10% ratio for me, which is about average in the country. Next slide, please. On this outline, I'm going to teach you how to identify life-saving action and when to implement it, and how to perform proper chest compressions. Most people do not perform chest compressions correctly, and I'm pointing to EMTs as well as ambulance drivers. I've seen it too many times, so hopefully I'll teach you how to do it correctly in this short presentation. Next slide, please. What is CPR? It's cardiopulmonary resuscitation. Heart, blood. Pump the heart, it gets the blood flowing, gets oxygen to the brain, your patient has a chance to live. Next slide, please. So this is something you can read when we're done. I'll pass these out to you. If you can pass these out, just give everyone one. It's basically, the most important thing to me on this was 90% of people who experience an out-of-hospital cardiac arrest will die. There's that 10% I was talking about, in which I had 1 live out of 6. Next slide, please. So what are the signs of cardiac arrest? This is the first thing we have to look at. Signs: clutching the chest. It's very painful. You will notice if someone is having a heart attack. 2, they have trouble breathing. 3, they finally end up passing out on the ground. Okay? So you've seen that. You may have. Hopefully you haven't. But you may have. And somebody probably acted on them if it wasn't you. So let's go to the next slide, please. So this basically are the steps that you should take as a first responder when performing CPR. First thing, you make sure the scene is safe. If the scene isn't safe and you go in and you get hurt, now I've got 2 patients I've got to deal with. I don't want to do that. So make sure the scene is safe. When you get down to the person, tap them on the shoulder, shout, "Are you okay? Are you okay?" See if they have a reaction. If they do, that's good. If they don't, then you call 911, you open the airway, you check for breathing, and then you start your compressions, okay? When you do your compressions, I have this picture slide of the Bee Gees. Who knows the Bee Gees? 1, 2, and the rest of you don't. Okay. The Bee Gees did a song called "Staying Alive." It's what the American Heart Association suggests for using for your tempo, your timing when you give compressions. So basically, it is 60 compressions per minute would be your tempo. I'm not going to sing it for you. Don't ask me because I don't know how to sing. Let's go to the next page, please. Next thing you do is you open the airway on the patient. When you open the airway, you do what they call a head tilt chin lift. You tip the head back, pulling the chin up. This opens up the airway. When a person falls or passes out, their head sometimes is down. They have no airway. It's blocked. You head tilt chin lift, create an airway. Sometimes when you do this, it actually could revive them and they could be fine. Next page, please. Can we get rid of this or no? Can you? No? Okay, that's fine. That's good. Thank you. Okay, so proper chest compressions are the key to survival or doing proper CPR. Okay, if you notice these 2 pictures here in your handouts as well, this person is doing it wrong. If you notice, I call this the bended arm example, right? If you see her arms are both bent, she is not getting proper chest compressions. She's not using her body weight to push down on the heart. This is, I call the stay away example. Stay away from me. She's too far. She's not leaned over the patient. You have to be over the patient when giving proper CPR compressions. Let's go to the next slide, please. Here is proper position. This first responder is directly over the chest, directly over the heart, looking straight down on that heart and using his body with locked arms to push down on that heart, creating blood flow. Here's the proper hands that you use. You grab, clench inside, and with the arms locked, here's how it looks, everyone. Got it? Okay, any questions on chest compressions? Go ahead.
How do I know if I am doing effective compressions?
Question is, how do I know if I'm doing effective compressions? Basically, when you're going up and down, giving the compressions, you're trying to go down at least 2 inches. Okay? 1.5 to 2 inches. I prefer 2 inches. I actually prefer breaking the ribs, because then I know I'm doing effective compressions. Like I said, I've seen people doing this where the ribs are going maybe 1/4 inch, not even touching the heart. Keep in mind, people, here's the ribs, okay? It surrounds the heart. The heart is in the inside here, okay? It surrounds the heart. It acts as a shield. Like when you see a Roman movie, gladiator movie, they all wear these big shields. They're protecting their chest. The ribs protect the heart. So make sure you get those ribs down 2 inches, okay? If you break the ribs, don't worry about it. People panic, oh, the ribs broke. You will hear it if you're doing the compressions right, okay? All right, let's go to the next slide. So here's my conclusion. Basically, practice what you're going to learn tonight. When we're done here, I'm going to take you in the other room and we're going to go ahead and do CPR. Got a couple dummies out there, and we'll be able to really get a hands-on experience. I'll go around, I'll watch you, and if you have any questions, be more than happy to answer for it. Any questions you have. If you take a CPR class, plan on 4 hours of your day. The problem is, when you take these classes and you learn all this information, if you don't practice it, you're going to lose it. These skills can be lost if they're not practiced constantly. So I'm fortunate enough where I'm practicing it and teaching it on a constant basis. But you, as the bystander, now a first responder, need to really practice these skills. If you have any questions on CPR, you can always go to the American Heart Association. Just punch it in Utah. They have all sorts of classes going on that you can do, and learn other techniques as well. That's it. I appreciate you having me. Thank you so much.